Welcome to Orachards Dental. I'm Dr. Teoh. Today we'll be talking about gum disease and a few common questions that patients have for me about gum disease. So the first question is, what is gum disease and why does it matter? And so first off, think about your teeth. Around your teeth you have your gums. Underneath your gums you have bone, which supports the teeth and it supports the gums. What happens with gum disease is over time the gums and the bone around your teeth starts to shrink away. They start to pull away from your teeth, and as a result your teeth become loose. Now, gum disease is a chronic disease, meaning it's a long-term disease. This doesn't happen overnight, but usually over years, usually over decades actually. 10 years, 20 years, 30 years, depends on the person, but it does take quite a while for it to happen. The end result, as we were saying, is the teeth become loose. And when they become loose, for some patients, they're loose to the point that it's difficult to eat. It's very uncomfortable. For other patients, it's very painful, either in the gums, sometimes even in the teeth themselves, and patients at that point often request that we take out their teeth for them. Another thing that can happen is the teeth can become so loose to the point that they actually fall out on their own. So we treat gum disease to prevent the teeth from becoming loose. Second reason we treat gum disease is scientists nowadays are finding a lot of strong connections between gum disease and an increased risk of having other systemic health problems such as heart disease, heart attack, and stroke. So when we treat gum disease, we help to reduce the risk of having these other systemic problems such as heart disease and stroke. Second common question people ask me is, I've had gum disease for a long time and I haven't noticed any problems. Why should I treat it now? And it's a common question because, as we were saying, gum disease is a chronic disease. It's very slow progressing, but the problem is when it progresses to the stage that your teeth actually become loose, that's when it's too late. At that point, it's nearly impossible for us to grow back your gums and to grow back your bone, and really the only option at that point is to pull out all the loose teeth. So by treating gum disease early, even when you're not noticing any problems, that's really the best way to go about it, so that we don't end up at the point where all your teeth are loose and we can't do anything except pull them for you. So that's it for today. I hope you learned something and hope to see you soon.